The Board of Aldermen met this morning to review data, discuss the Serving Oxford Safely plan, and meet with department heads. We have been closely tracking our numbers. We have a total of 393 positive cases identified in Lafayette County since March. We have 45 active cases today as identified by the Mississippi Department of Health. We've received questions about how active cases are determined. At the beginning of the pandemic, as we were tracking positive cases, we began to subtract cases that were more than 14 days from the reporting date, as they were assumed to be recovered. As of a week ago, the Mississippi Department of Health began sending us a daily list of active cases. Some of the cases on this list are only a few days away from the isolation end date. Some are actually even past the isolation end date. This is what tells us that our data from the state is definitely not timely. Our emergency management director has looked at many ways to analyze active cases. This is probably more information than you ever wanted to know, but I want to err on the side of too much information rather than too little. Today's list has a positive case that was reported to us on July 3rd. The listed date for this case to come out of isolation was June 28th. So if we were using our original way of subtracting after 14 days, then this case would have been listed as active until July 17th. The past 2 days have shown an increase of 2 positive cases per day. We do tend to see lower numbers on Mondays and expect lower numbers after a holiday weekend, since many people avoided going to get tested over the holiday. We also expect to see a rise in cases in 10 to 12 days statewide, as the effects of the large gatherings over the holiday take their toll. We continue to gather data from local medical clinics. We have received reporting from 9 clinics. These clinics have not responded daily. Some sent a report for the month of March through June, some have sent it for several week periods, and some daily, making it difficult to give you exact numbers. But we know that more than 267 positive tests have been identified from non-Lafayette County residents. So that is 393 plus the 267, giving us at least 660 positive cases so far. It is encouraging to know that we have had only 4 deaths and our hospitalization numbers remain low. We are continuing to monitor hospitalization numbers. I spoke with our hospital administrator this afternoon, and he assured me that they have plenty of PPE, capacity both in regular beds and ICU beds are in good shape, and they are not limiting anything from an elective standpoint at this time. They will continue to communicate with us daily, and I will let you know if there are any concerns. I understand that many of the patients that have been admitted in recent weeks are actually from outside of Lafayette County, from smaller communities, as our hospital serves the region, not just Lafayette County. Our board discussed today different options for rolling back the reopening. There was discussion about closing bars earlier. It was decided that the closing time of bars would remain as it is. The reasoning is twofold. We have stepped up our enforcement, and it is easier to patrol the bar crowd in a 2-block area rather than all over town. When bars were closing at 10, we were receiving calls regarding parties across town and found that more difficult to identify and enforce. I'm aware that parties will still happen after bar closing, no matter what time that takes place. We will continue to monitor the activity in the bars and will make changes as needed. Chief McCutcheon reported in our meeting today that OPD has done 265 compliance checks over the past week and have written 7 citations. None of those citations were written to bars. We have a downtown unit that will be strictly enforcing our safety plans in the downtown area. We want to set the tone for what the fall will be like when the students are back, and we'll make sure that we get off to a good start with diligent enforcement. I'll tell you that personally, going back to curbside is to me the only way to curb the spread as we were able to do months ago. If the bars and restaurants are open, even at 50% capacity, to me the 3 hours don't really make a big difference. I hope that we do not have to restrict further and go back to curbside. I don't believe our business community can stand another shutdown. We want to do everything in our power to protect our community. We know that social gatherings are the source of the majority of the spread. This isn't only college students. You can glance through social media and see large gatherings of families, neighbors, and friends having cookouts, and kids having large birthday parties and lake days and social events. The board voted today to return to the Phase 1 plan for group gatherings. The limit for inside social gatherings is now 10 people if social distancing is not possible, and 20 people if it is possible. This only applies to social gatherings and not to businesses. Businesses will remain in the same requirements that they have been in for Phase 2. Face coverings will continue to be required in all businesses. Oxford School District released their plan to go back to school today. City and school leaders are working together as we prepare for the fall. We support their reopening for our students and believe it is critically important for our students to get back to school. We do not believe that the bar hours correlate to the reopening of schools, and I'll reiterate that our enforcement will be increased in an effort to ensure that our citizens are protected and our economy can continue to improve. This virus is real. I know that everyone is tired of the battle, but we can't throw in the towel. Your community needs you. We all need each other to be successful, and we are stronger together. Thank you.